Hey everybody, this is a CNN broadcast that is going on right now. I stopped it so you can hear it. It has to do with how the Trump administration officials were encouraging immunity by a herd mentality. I'm not kidding you. It was a very cold set of emails that Breonna Keeler on CNN is about to read to you. I warn you of that. Listen to this as I zoom in on the coronavirus pandemic.
Throughout the pandemic, even as Trump administration officials all the way to the top insisted they were not pursuing herd immunity with their laissez-faire response to the coronavirus, their words and actions gave them away. Herd immunity, of course, is when enough of the population has been infected with the pathogen that it provides protection for those who haven't been. With the coronavirus, in the absence of a vaccine, 2 million Americans would have to die by the time we would achieve herd immunity. Needless to say, it's not a public health strategy. But we have now learned that a former top appointee of the president's urged health officials to make it so, according to emails obtained by the House Oversight Committee. In one of them, Paul Alexander, who is a former senior advisor at the Health and Human Services Department, said in July that Americans, quote, must go on with life. He said this: "So the bottom line is, if it is more infectious now, the issue is who cares? If it is causing more cases in young, my word is who cares? As long as we make sensible decisions and protect the elderly and nursing homes, we must all go on with life. Who cares if we test more and get more positive tests?" In another email, he writes, quote, "There is no other way. We need to establish herd. And it only comes about allowing the non-high-risk groups expose themselves to the virus, period." And he punched his caps lock button to make his point there. So adamant was he that herd immunity was the only way to address the virus. Of course, he's dead wrong. Of course, there's another way. In the history of our country, the government has asked Americans many times to go to war to protect their nation. And that has meant sacrificing months and even years with their families. They have been asked to risk their limbs, their minds, their lives. On the home front, Americans have been asked to ration food and other goods, to practice bombing drills and repurpose their businesses. The sacrifice asked of Americans in this crisis is to save lives by staying home and wearing a mask when they can't. And the president and his allies have bastardized that call to action as an unacceptable infringement on personal freedom. That former HHS advisor, Paul Alexander, by the way, he hasn't responded to CNN's request for comment on his advocacy for herd immunity, but the Department of HHS tells us he was only temporary and that herd immunity is not the department's policy. It may not be the official policy of HHS, but it sure was the policy of a lot of officials in the Trump administration, including the president. Now, of course, the White House has denied that. Here was the press secretary in September.
Herd immunity, so-called theory, was something made up in the fanciful minds of the media. That was never something that was ever considered here at the White House.
But it was by Dr. Scott Atlas, the president's preferred coronavirus advisor, who left the White House after the president lost the election. Of course, Atlas denied it because herd immunity as a health policy is homicidal.
It's not just a lie, it's an overt lie. It's a disgusting lie, and it's a harmful statement to make. I have never advised the president to push a herd immunity strategy. I have never told the task force that I advocated a herd immunity strategy. I've never told anyone.
It may be disgusting, but it's not a lie, it's the truth. There is tape of Dr. Atlas pushing herd immunity.
We can allow a lot of people to get infected, those who are not at risk to die or have a serious hospital requiring illness. We should be fine with letting them get infected, generating immunity on their own. And the more immunity in the community, the better we can eradicate the threat of the virus, including the threat to people who are vulnerable. That's what herd immunity is.
When younger, healthier people get the disease, they don't have a problem with the disease. I'm not sure why that's so difficult for everyone to acknowledge. These people getting the infection, it is not really a problem. And in fact, as we said months ago, when you isolate everyone, including all the healthy people, you're prolonging the problem because you're preventing population immunity. Low-risk groups getting the infection is not a problem.
And there is also tape of the man that Atlas advised about this strategy, pushing herd immunity.
But once you get to a certain number, we use the word herd, right? Once you get to a certain number, it's going to go away.
Now, the president and his aides had backup from right-wing media outlets, and their darling was Sweden, which at the outset of the pandemic adopted a herd immunity strategy, even as it encouraged masks and social distancing.
Sweden has never, unlike Governor Whitmer and so many American states, adopted the Chinese model, the authoritarian model, in order to contain coronavirus. Yet so far, Sweden has fewer cases of coronavirus and fewer deaths than the state of Michigan does. Huh. Does the governor of Michigan know this? Does she care? No. That suggests it's about science, but it's not.
Herd immunity will be reached in about 2-3 weeks, perhaps, in Sweden, which, then they're kind of done after the herd immunity, correct?
Yeah, we hope so, and that's why we shouldn't pay too much attention to comparisons of cases and deaths right now, because almost every other country except Sweden has just postponed deaths.
Sweden was smart.
Hey everybody, I turned away from that segment because it was too long. Here's the rest.
All right, we'll fast forward to now, when it matters, and Sweden's herd immunity experiment is over, a failure by their own admission. Sweden just had its second deadliest month ever, second only to the worst month of the 1918 flu pandemic. Their hospitals are overflowing. The Swedish Prime Minister has admitted that their strategy was a mistake. Quote, "It is proof that it is a virus that we did not know about before and that behaves in a way many would not have thought." Worth noting there in that quote that the preponderance of public health experts warned what could happen to the infection rate in Sweden over time. The PM goes on, understating the obvious here, quote, "Some conclusions about where we could have been better have already been drawn." They have been drawn by a death rate that approaches that of the US, even with Sweden's universal healthcare system and liberal work leave policies. But Fox champions Sweden as the example to follow, and viewers listened. And they're doing this again right now, telling people to get together for the holidays.
Of course, act cautiously, but Christmas is meant to be spent with your family, not isolated and locked down. Joining.
Okay, I've stopped it there because it's becoming more of a Fox News presentation. I want to hear what Fox News had to say. I turned to Fox News. But the bottom line is that this matter of a herd immunity strategy is still being pushed, and it was pushed by the administration, even as much as they denied it. Subscribe to Zennia62 and bookmark oaklandnewsnow.com.